Nursing is an exciting profession that is characterized by a worldwide demand for trained professionals. Nursing is among the leading careers in the United States and will likely remain so through 2026. It's predicted that another nursing shortage will occur by 2030 as an estimated 1 million nurses will retire by this year, with the greatest shortages found in the South and West regions of the United States. Nurses are regarded as trusted leaders who promote the health of clients and communities alike. Historical figures in nursing are renowned for their roles in establishing the nursing profession, for innovating to create specialized nursing schools, and for establishing agencies like the Red Cross. Nurses play several key roles in providing care to their clients, guided by science and motivated by compassion. In this lesson, we'll talk about some nursing roles, including care provider, case manager, researcher, educator, leader, manager, and change agent. Issues and trends affecting clients and nurses are also explored, along with nursing organizations and the various guidelines, rules, and regulations applied to the practice of nursing. Here are our learning objectives for this presentation. Development of the nursing profession, defining a profession. The nursing profession is a highly specialized field in which knowledge and care are constantly evolving. Nursing has been described as both an art and a science. Nurses utilize knowledge and skills that are based on scientific facts while performing the art of caring with compassion, dignity, and intuition. Nurses work independently as well as interprofessionally. They can act in the role of a preceptor or supervisor or be involved in research. But most of all, the nurse provides care to the client and works in collaboration with the health team to address the client's needs. Often, society is unaware of or unable to describe what nurses do or what the profession of nursing involves because of the broad role the nurse performs. Remember this, the American Nurses Association has defined nursing in Nursing Scope and Standards of Practice, a document that provides a framework for all nurses and clarifies what nursing involves and the responsibilities of the nurse as a professional. So the Scope and Standards of Practice of Nursing was created by the American Nurses Association. The scope of practice describes the following: what the nurse does, what the nurse's responsibilities are, where and when the client is to be performed, and why and how client care is achieved. Nursing is defined by the ANA, the American Nurses Association, as follows: protecting, promoting, and advancing clients' health, averting illness and injuries through health promotion, using the nursing process to facilitate clients' recovery from illness or injury, minimizing or eliminating client suffering, advocating for the care and health of the client, family, or community. Nursing Scope and Standards of Practice, created from the American Nurses Association, I've said that 3 times, you probably should remember it, forms a solid foundation for a nurse's practice. However, this document is just one of several resources defining nursing practice. The Nurse Practice Act, remember this, is a legal and regulatory body that is created by and applicable in each state. The Nurse Practice Act establishes common definitions, rules, and regulations to guide the practice of a licensed nurse and thereby promote quality of care and safety when caring for a client. The Nurse Practice Act establishes common definitions, rules, and regulations to guide the practice of nursing. Very important. We also have a code of ethics for nurses, which assists nurses with ethical decision making by incorporating the nurse's value system, duty, obligation to the client, and call to uphold professional ideals. As a nurse, you are obligated to practice not only within state rules and regulations, but also by following specific policies and procedures within the direction of the facility where the nurse is working. A nurse, through acquired knowledge, skills, and critical thinking, determines the appropriate response based on the scope and standard of practice, rules, laws, regulations, and facility policies and procedures. Based on this self-determination and nursing identity, Each individual nurse is responsible for his or her own practice, for making these decisions and acting professionally within the role as a nurse. Nursing historical contributions. For more than 200 years, nurses have been at the forefront and on the front lines of providing care to those who are sick and injured, as well as preventing illness, traumatic injuries, and the spread of communicable diseases. In the late 19th century, society recognized the need for nurses to have formal education in the nursing discipline. In 1872, the first school of nursing opened. This development had a ripple effect across the United States as many hospitals built their own schools of nursing. These schools of nursing provided hands-on clinical experience and very little theoretical classroom learning. However, by the 1970s, technology had exploded, and many colleges and universities began to offer 2- and 4-year nursing degrees that entailed a combination of clinical and classroom learning. In the early 1900s, nurses were not licensed and did not have any professional organization to provide them with a strong collective voice to represent the nursing profession or advocate for the healthcare needs of their clients. Today, in contrast, male and female nurses are highly respected, well-educated leaders in healthcare. As nursing moves further into the 21st century, the profession has evolved in several aspects since its early beginnings: in nursing education, licensure, creation of advanced practice roles like nurse practitioners, certification, and professional organizations. However, one thing remains constant. The focus throughout nursing history and currently has been to reduce harm and the negative impact of crises on nurses and their clients, as well as to promote healing and health, resulting in maximum success for their clients. In 2020, the Smithsonian Institute celebrated the 200th anniversary of the birthday of Florence Nightingale, one of the most prominent figures in nursing history. Florence Nightingale demonstrated what is now called evidence-based practice by engaging in data collection and reporting her findings. Very important to remember, Florence Nightingale demonstrated what is now called evidence-based practice. That's very important. That is a huge contribution that she made to the profession of nursing. Florence Nightingale connected unclean conditions to wound infections during the Crimean War and observed that overall cleanliness, hygiene, and antisepsis when caring for soldiers reduced infection rates. Isn't that cool? Nightingale continued her legacy by starting some of the first schools of nursing. During the Crimean War, she was called the Lady with the Lamp because she carried a lamp at night to check on the soldiers. So what you need to remember is that Florence Nightingale created evidence-based practice, and she was the one that showed that overall cleanliness, hygiene, and antisepsis helped infection rates. She also started some of the first nursing schools in the country. So very important 2 facts to remember about Florence Nightingale. Other pioneering nursing leaders included Clara Barton and Dorothea Dix. Barton personally served in the battlefields, bringing necessary supplies, comfort, and food to the wounded. She created a center to locate missing soldiers and started the American Red Cross. When I say Clara Barton, you say American Red Cross. That is her major contribution. Dorothea Dix was not a nurse, but rather a teacher. She volunteered to care for soldiers during the Civil War and was subsequently appointed Superintendent of Army Nurses for the Union Army. That's an amazing accomplishment. In this role, though, she set up temporary hospitals on the battlefield, organizing and training nursing recruits. Like Nightingale, Dorothea Dix pushed for formal training for nurses. She was best known for her advocacy for mental health reform and Indigenous rights. Florence Nightingale, evidence-based practice and schools of nursing. Dorothea Dix for advocacy for mental health reform and Indigenous rights. '20th century nursing leaders also offer examples for inspiration. Nursing education. Nursing is a unique profession with its varying levels of education for nurses. depending upon the length of time of the program and the degree desired. The choice of nursing program to pursue is often made according to the final degree desired. The many options for obtaining a nursing degree are divided according to the levels of advancement within the position. Pre-licensure nursing educations includes LPN. A licensed practical nurse, LPN, or a licensed vocational nurse, LVN, degree can be attained in 1 year. A registered nurse, RN, degree can be achieved in 2 or 4 years, depending on which of the following educational programs is chosen. A diploma nurse, hospital-based, non-degree, an ADN, which is an associate degree in nursing, or a BSN, which is a bachelor's degree in nursing. Nurses can also get a master's degree or a doctorate level of education, along with advanced abilities, experience, knowledge, and critical thinking skills that enable them to practice without additional regulations. Lifelong learning. Patricia Benner, 1982, described the transition from novice nurse to expert nurse. A novice nurse has no professional experience. A beginner nurse can note recurrent, meaningful situations, components, but not prioritize between them. They can tell what's wrong, but don't know what's the important stuff. Competent nurses begin to understand actions in terms of long-range goals. Proficient nurses perceive situations as wholes rather than in terms of aspects. And expert nurses have an intuitive grasp of the situation and can zero in on the accurate region of the problem. Novice to expert is where a new nurse goes through 5 stages of clinical competence in acquiring new knowledge and clinical skill acquisition while gaining clinical experience and improving their clinical practice. This theory of continuing education emphasizes lifelong learning and the development of clinical skills and knowledge through practice. LPNs and LVNs practice nursing under the supervision of an RN, a registered nurse. Each nursing degree has different lengths of study and difficulty, but all candidates for degrees are required to take the same National Council Licensure Examination, that's our NCLEX, after graduating from your pre-licensure program. Nursing programs are structured to provide students with the information and experience to succeed. Students are required to pass the NCLEX licensure exam to receive a license to practice. Upon passing the licensure exam, nurses are expected to follow the Nurse Practice Act for the state in which they practice. Digital learning and technology in nursing education. Technology trends in education include online learning, use of electronic devices, and simulation experiences. Online learning resources have the advantage and flexibility of availability and ease of use for the learner, allowing the student to continue to work and care for family while not being in a classroom. These resources, like ATI, are designed to be individualized and provide feedback and support. Online study is eco-friendly, cost-effective, and continually updated. This type of learning may also present some challenges such as depersonalization, technical difficulties, and decreased student-teacher interaction. I think we may feel some of those growing pains. Courses and books are still part of the classroom curriculum and are often designed to be viewed on personal devices, which allow further flexibility and availability of learning resources. Classrooms are still predominantly held on campus as face-to-face learning has its place and many courses cannot be completely taught online. Simulation is an experience that often uses a computerized mannequin to model or replicate a clinical experience, allowing for a safe and reflective learning environment. Simulation offers opportunities to practice skills and learn in simulated real-life experiences within a safe and controlled learning environment. Students are not expected to know everything at once, but may prepare for the experience and then learn through repetition and by communicating and collaborating with their peers. Feedback is given during the review or debriefing of the simulated scenario in real time to enhance student learning. Back to Patricia Benner. Lifelong learning occurs throughout the nursing career, whether that learning happens through individual study or by working with others. Nurses gain valuable experience by interacting and learning from other nurses and by sharing knowledge, best practices, and expertise. Respect for the knowledge of others, regardless of years of service, is the key to valuing all levels of proficiency, as the length of experience is not the only determination of knowledge. Nurses in leadership positions can be valuable in establishing a collaborative culture and encouraging positive interactions between new and experienced nurses while creating an atmosphere of mutual respect and a solid foundation for teamwork. Dr. Patricia Benner introduced the novice to expert model for nursing competence in 1982, detailing how nurses develop skills and understanding of patient care. This model remains relevant today and it describes how a nurse progresses through 5 stages of new skills and knowledge are acquired, ending at the expert stage. Nurses can gain valuable knowledge by collaborating with and observing nurses with more experience and expertise in the field or specialty. The 5 stages of proficiency in the novice to expert model are novice, advanced beginner, competent, proficient, and expert. Stage 1, novice. This initial stage covers nursing students and new nurses who have no previous experiences. Novices cannot yet draw on their own judgment. The novice struggles to decide which tasks are most relevant in real-life situations. Stage 2, advanced beginner. The advanced beginner has been involved in enough real-world situations to be able to recognize patterns and recurrent situations. A problem at this stage is that the focus is on remembering and following the rules and guidelines that have been taught. The advanced beginner needs clinical support to set priorities so that clients receive the care they need. Stage 3, competent. The competent nurse is able to prioritize tasks by drawing on past experiences. These nurses may not function with the same speed or ease of change as proficient nurses, but they have mastery in multiple areas. Competent nurses recognize patterns in clinical situations more quickly and accurately than advanced beginners can. Stage 4, proficient. The proficient nurse is able to understand the bigger picture or the desired outcome of situations, which facilitates improved decision-making. Proficient nurses are able to respond to changing situations and modify plans in the face of different events. Stage 5, expert. The expert nurse has extensive experience and knowledge to draw from when responding to complex client situations. At this stage, nurses have self-confidence and trust their intuitive sense of a situation. Expert nurses know what needs to be done and are able to perform it well. Health literacy. This is a definition that you will need to know for your exams for sure. Health literacy is the capacity to obtain, communicate, and understand basic health information and services so as to make appropriate health decisions. Health literacy is the capacity to obtain, communicate, and understand basic health information and services so as to make appropriate health decisions. You are literate about your health so that you can make good decisions. This concept can be applied to the health literacy of the nurse and other healthcare professionals and their actions to impact the health literacy of the clients they care for. For example, providing clients with information to enhance understanding of their personal health-related concerns, such as medication, diagnoses, or diet, is critical to those clients taking responsibility for their own health literacy. Finding out where and how to obtain accurate and current health and medical information can be a challenge for clients, families, and caregivers. Nurses can empower clients to improve their health literacy by carefully listening to their clients, understanding and accepting their concerns, and providing them with clear and correct information and resources. Social media and other internet sites are often the first sources of information for clients. It is the responsibility of the nurse to provide accurate information so that clients can use it to make informed healthcare decisions. A current nursing education trend is to include health literacy as part of the curriculum, which we are, so that nurses will understand their clients' perspectives and challenges and can be better advocates for their clients' healthcare literacy. In order for us to promote our clients' healthcare literacy, we as nurses also have to be literate and understand what is appropriate healthcare techniques, healthcare actions and how to communicate those to our patients. Holistic nursing care is a definition that we as nurses need to understand, and that means we provide care for the whole person, meaning their physical, their mental, their emotional, and spiritual health, whether we're providing direct care for them or we're advocating and arranging for appropriate care to fulfill the client's needs and concerns. We aren't just treating an illness, we're treating the physical illness, the mental aspects, emotional aspects, and the spiritual health when we provide care for our patients. As nurses, we also have to respect the unique differences of all individuals. Nurses are trusted to address their diverse clients with integrity, honesty, and compassion, regardless of the nurse's feelings and beliefs and the client's identity. Individuals who experience discrimination and non-acceptance do not feel supported or respected, which may result in their health care needs not being addressed or met. Nurses must respect the individual and unique differences of all of our patients. Nursing roles and competencies. Nursing roles. Nurses fulfill multiple roles on a daily basis as they care for clients. These roles can have a direct impact on the care of the individual client or a group of clients with the same diagnoses who may be receiving similar care. In addition to the direct effect on client care, several of these roles can impact the teamwork demonstrated by the nursing staff, the culture of the work environment, and the advancement of evidence-based nursing practice. This section explores each of these roles and considers how the nurse uses these roles in the best interest of the client's lives. A nurse is most often identified as a care provider. Nurses have been educated to provide knowledgeable, compassionate care to promote health and address illness. Nursing practice is built on shared sciences such as physiology, microbiology, and psychology. Along with the scientific foundation, nurses are taught critical thinking, the value of holistic care, and evidence-based nursing skills so that they can provide direct care to their patients. Nursing focuses on care of the whole person, physical, mental, emotional, and spiritual health, and the nurse has a unique role as an advocate for the client. By understanding the needs of the whole person and demonstrating empathy, a nurse is better able to provide the client with the care needed and to communicate with the healthcare team to help meet those needs. An effective care provider communicates and works well with the client and other coworkers and is a strong advocate for the needs of the clients and their families. Nurses must be able to provide professional empathy to all clients, regardless of their race, illness, socioeconomic status, ethnicity, religion, and level of education. A critical part of caring for the whole person is being sensitive to the individual cultural preferences, also referred to as practicing culturally competent care. Culturally competent care is caring for the whole person and being sensitive to the individual cultural preferences. This complex concept must be taught to nurses as well as healthcare employees. A nurse learns awareness and appreciation of clients' personal cultural values and practices and how they affect clients' perceptions of their health. Even the most basic communication with a client requires knowledge about that person's language, preferences for family, inclusion, exclusion during health discussions, need for an interpreter, health practices and spiritual care preferred by the client, and level of education, knowledge, and health literacy. Successful client outcomes are more often achieved by nurses who make the effort to educate themselves about their clients' cultural preferences and needs. Being a care provider is an essential role for all nurses. Clients' safety and health outcomes depend on the nurse being a competent care provider. Although nursing tasks are important, the nurse must see the role of the care provider as being much broader than simply completing a task such as medication administration. On a daily basis, the nurse as a care provider is key to the delivery of person-centered care. Case manager. The complexity of the healthcare delivery system and the increased number of clients who have multiple health problems, also known as comorbidities, comorbidities mean having multiple health problems, have been identified as a potential cause that may lead to fragmentation of the care services clients receive. Thus, another role that nurses must incorporate into their nursing practice is that of a nurse case manager. As a case manager, the nurse works with the client, the family, and the healthcare team to ensure that the client receives needed services. Nurses manage the care of the client by communicating with the appropriate interprofessional team members to create a plan of care that will meet the needs of the whole client, including the need for interdisciplinary services like physical therapy, occupational therapy, enterostomal therapy, home health nursing, and speech therapy, as well as coordinating the client's educational needs as they relate to the disease process, medications, and discharge instructions. During the nurse's role as the care provider, the client's need for additional services or coordination of those services and education will become apparent to the competent nurse. The nurse can suggest a consultation for an interdisciplinary service or may coordinate the timing of a physical therapy session and diagnostic testing to avoid the client becoming fatigued, hypoglycemic, or short of breath. These actions as a case manager by nurses have been demonstrated to lead to safer and more effective care of the client. Although the nurse who is providing care often manages the daily or short-term care of the client, many facilities have established a formal role of case manager, which is often held by a nurse who has clinical experience. In addition, this formal case manager role may require an MSN or a certification in case management. Case managers are consulted to assist in coordinating needed services once the client is discharged. They typically do not provide direct care to the client. They need to be knowledgeable about the client's insurance and the services covered through that insurance, or they may need to assist the client in obtaining insurance to cover the costs of services being provided or needed upon discharge. They can then facilitate, coordinate, and advocate for services to meet the client's need and develop a plan for discharge. The case manager serves to provide a seamless transition to home or a long-term care facility and continuation of the needed services to assist in the care of the client. Researcher. All nurses have a role in research. As direct care providers, nurses utilize research to provide evidence-based care. Evidence-based practice is the delivery of care, like procedures, assessments, interventions, that is supported by scientific research showing its factual accuracy and effectiveness. Do you remember who the founder of evidence-based practice is? If not, you must re-listen to this slideshow to find out. The use of evidence-based practice helps to assure clients are receiving the best care. Nurses keep informed on evidence-based practice by reading scholarly resources to find the most valid and current information about new medications, procedures, or technology. Nurses who serve on a quality improvement committee can also use published research to improve the care of clients. In addition, the direct care provider nurse may assist a researcher, like a nurse or a physician or a PhD student, in the collection of data or a clinical trial of a new procedure, medication, or diagnostic test. Some facilities encourage nurses to learn more about research and offer various continuing education opportunities related to this area. In the formal role of nurse researcher, the nurse develops nursing knowledge by conducting research and publishing the results. A nurse researcher can be hired to work in a laboratory at a pharmaceutical company or in the field, oncology or neurology, in a variety of settings, inpatient or outpatient clinics, or in a university school of nursing. Nurse researchers or nurse scientists should be PhD prepared and have experience with research and evidence-based practice. They are responsible for designing scientific research to answer pertinent questions about an intervention or the client's feelings or experience with the disease process. Such research is designed to provide a base of knowledge to the nursing profession through a systematic inquiry design and by proving hypotheses to be true or not true. Overall, ongoing research aims to improve nursing practice by generating evidence for nurses to use in the care of their clients. Another role that the nurse assumes in the care of clients is that of an educator. Client education is a critical intervention that nurses implement daily. Educating clients serves to increase their knowledge, which empowers them to employ appropriate self-care management skills and to make informed care decisions and can improve the quality of life of their clients. In addition to client education, nurses are responsible for helping to teach student nurses and serving as preceptors for newly hired nurses. Student nurses' clinical experiences foster their competency as care providers as well as their development of a professional identity as a nurse. The interaction between the student nurse and the nurse can influence whether the student continues to pursue nursing. Therefore, it is of the utmost importance that nurses assist student nurses in their learning during clinical experiences. Nurses who serve as preceptors to newly hired nurses are experienced staff members. The preceptor helps the newly hired nurse to transition to a new role from student nurse to staff nurse or from staff nurse at another facility unit to the current position. The preceptor provides clinically appropriate experiences, assists with the development of new nursing skills and knowledge, is readily available as a resource for the new staff member, acts as a role model, and gives the new nurse feedback on his or her progress. Leader. Norhaus defines leadership as a process whereby an individual influences a group of individuals to achieve a common goal. The power of effective leadership is seen in the way a team works with seemingly effortless coordination. Strong leadership encourages effective communication, relationship building, and communicating and working together to create clear plans and achieve goals. Optimal client outcomes occur when nurse leaders foster interdisciplinary work. Manager. The nurse manager is an assigned leadership role. This role has evolved to meet the needs of the ever-changing healthcare delivery system. Nurse managers are formally responsible for a team of nurses and have a significant impact on their team's job satisfaction. A nurse manager has overall responsibilities for the assigned clinical areas, including managing the staff and ensuring the quality of care being delivered. Specific responsibilities of nurse managers include hiring, orienting, scheduling, and evaluating nurses. Nurse managers help problem solve for staff, clients, and agencies. Managing supply and equipment availability, maintaining budgets, and creating goals and objectives for the unit are among the daily duties of the nurse manager. This role is vital to the cohesion of the team and the ultimate health of the client. Nurse managers strive to achieve a balance so that the workplace is focused on safety, health, and satisfaction for both clients and staff. Support education for this role are critical to prevent manager turnover. Other nursing competencies. Nursing competencies are the knowledge, attitudes, values, and skills that nurses are expected to know to provide safe care. Nursing competencies are the knowledge, attitudes, values, and skills that nurses are expected to know to provide safe care. These competencies have different levels of attainment, such as novice, proficient, or mastery levels, or are based upon performance or standards achieved. The competency of advocacy. The ANA, the American Nurses Association, definition of nursing includes advocacy as one of the pillars of nursing in the provision of care to individuals, families, and communities. As client advocates, nurses support, protect, and promote the rights, health, and safety of a client. A client can voice to the nurse who is preparing the client for a surgical procedure that they do not want to have the surgery. The nurse needs to act as the client's advocate by immediately contacting the surgeon, so the client, surgeon, and nurse can discuss the client's concern. Another example of client advocacy can be seen when a nurse becomes aware of a potential safety or privacy issue, like malfunctioning equipment, a peer who was talking about a client in the elevator, and then corrects or reports this concern. Advocacy also applies to championing nursing interests directly with decision and policymakers. Nurses can be involved in this process by becoming active in facility committees like staffing committees or quality improvement committees, local, state, or national nursing associations, or other nonprofit organizations that impact the health of clients who have an illness, cancer, substance use disorder, or mental health problem. An example of advocacy at the local level might be the nurse who is a member of a local nonprofit organization focusing on suicide prevention. This nurse could assist the nonprofit organization in obtaining funding by writing a government grant application or by lobbying the local school district to have educational programming about suicide prevention for grades 6 through 12. Such forums connect nurses, provide platforms to share their perspectives on current issues, and support nurses' efforts to employ policy and build and improve programs to promote health. Nursing competency change management. Nurse managers are the leaders on their units, which means they are also responsible for change management in their areas. Improvements in client care, staff processes, and the coordination of the teams on the unit are in constant flux due to the evolving updates in healthcare and the increasing acuity of clients. Nurse managers can adapt by being effective change managers with a goal of continually improving the staff workflow and the client outcomes. Effective change managers are characterized by a strong client safety culture with organizational learning, skill improvement, non-punitive responses to errors, with open communication and feedback from nursing staff and clients. Nursing competency communication. Communication in nursing is the one truly personal way that nurses can convey trust, empathy, understanding, cultural consideration, and interest, all without even speaking a word. Nurses can achieve effective communication by beginning with intentional listening, showing compassion, and demonstrating respect for the individual client. The nurse offers a calm, nonverbal presence through listening and presenting a physical posture of openness and calmness. Verbal communication is addressed through acknowledging cultural considerations, displaying awareness of any difficulties of speech, hearing, or language, and recognizing the need for a translator. Respectful assessment of the client's communication needs, followed by adaptation or provision of necessary resources to accommodate those needs, is the beginning of effective communication with the client. Communication with colleagues is also critical to effective client care. Nurses communicate and collaborate with the healthcare team verbally as well as through written and electronic documentation. Communication is multifaceted, including listening and observing nonverbal cues with awareness of professional roles and cultural and personal preferences. Effective communication among health professionals is called interprofessional communication. Nursing organizations. Nursing practice is regulated at the state and national levels as well as through partnerships with various nursing organizations that provide standards of care for nursing practice. Nurses look to these organizations for guidance and support and to stay current and relevant in their practice. Professional organizations provide the foundation for regulation of nursing practice, as well as pathways for becoming certified in specialty nursing areas. The list of nursing organizations is extensive, and we'll just mention a few. The National Academy of Medicine is a nonprofit private business that provides objective data intended to improve the health of society. It emphasizes a scientific, evidence-based approach to issues that affect the world, working collaboratively to discover solutions to health problems. The National Student Nurses Association, SNB, founded in 1952, is a nonprofit organization created for nursing students to provide an introduction to professional development through national conventions, networking, and career development activities. Its mission is to prepare nursing students across all program levels for initial licensure and to educate students about standards of nursing practice and professionalism. The NSNA also strives to promote the advancement of skills that will allow nursing students to become trustworthy members of the nursing profession. With more than 60,000 student members, the NSNA generates excitement about the nursing profession by giving students a platform for camaraderie, leadership, and connections to nursing leaders and other students. It communicates with members about current issues and regulations in nursing and provides an introduction to the politics of leadership in the nursing profession. The NSNA produces a nursing magazine, Imprint, which keeps nursing students up to date on the current trends and issues in nursing and encourages students to write articles for publication. The NSNA's Code of Ethics identifies 6 core values important to the development of nursing students: advocacy, leadership, professionalism, care, diversity, and quality education. The American Nurses Association, the ANA, founded in 1896, provides support to more than 4 million nurses across all states and territories in North America. This organization strives to enhance the nursing profession by encouraging elevated standards of nursing practice, promoting a work environment that is secure and ethical, improving the health and well-being of nurses, and being a voice for healthcare issues that impact healthcare workers and the community. The American Nurses Association. The ANA provides nurses with a voice at the national level through lobbying for major issues in nursing, including changes in the healthcare system, broadening the role of registered nurses and advanced nurse practices, speaking on the important role of safe nurse staffing, providing whistleblower protection, and improving safety in the workplace. This professional organization is dedicated to providing standards and guidelines that promote nursing practice by clearly outlining the values and priorities for nurses. It offers many resources to nurses to guide and improve their practice, including the Code of Ethics for Nurses, Nursing Scope and Standard of Practice, ANA Position Statements, and Principles for Nursing Practice. The Code of Ethics for Nurses outlines behaviors and practices that nurses should abide by to provide responsible and ethical care. For example, maintaining human dignity and protecting clients' rights to privacy and confidentiality. Nursing Scope and Standards of Practice discusses the art and science of nursing while providing specifics related to specialty nursing practice. The art of nursing requires the nurse to maintain client dignity, provide competent client care, and collaborate with other healthcare providers, while the science of nursing encompasses the evidence-based practice that guides policies, practice, and the use of the nursing process as a critical thinking framework. When I say the American Nurses Association, you should think of the Code of Ethics for Nursing and the Nursing Scope and Standards of Practice. Those are very important pieces of the nursing process that were created by the ANA. Please know that there are many current issues in nursing and healthcare that affect our nursing practice. Some of them are listed here. I ask that you read the notes and be familiar with them, but I will not be testing you on these for our semester. Please read over this great summary of the PowerPoint presentation you just heard. Thank you.